and we have free health system. But the problem is there are like a lot of longer kind of lines for these medical treatments. So some people who can afford choose to come to India, not only for the affordability, but also for the quality of treatments they are getting from India.
I would recommend that, like a tourism ministry, let there be a healthcare tourism ministry also, either independent or as part of the tourism ministry. That will give quite a lot of substance to this effort to bring in healthcare and healthcare tourism as a whole.
Please join me in welcoming Mr. LG Dissanayake, Minister Counsellor Commerce, Sri Lanka High Commission to India. Colonel Rajeev Mannali, CEO, SUT Pattom Hospital, Thiruvananthapuram.
So it's people-to-people exchange. One, it strengthens the diplomatic relationship, the relationship between the nations. Second, it also facilitates creating that accessibility and knowing exactly where to go.
I see a lot of like areas where we can collaborate, like you can have kind of a integrated referral system where sometimes post-surgery care could be done in Sri Lanka, kind of a thing.
There is so much that we can offer, and SUT Pattom, that's my hospital, it's one of the most affordable hospitals. I believe that affordability is a factor which hospitals like ours can provide. Accessibility, especially for Sri Lanka and Maldives, we are the most accessible.
Basically, we have to build an ecosystem of trust. We need to bring transparency, affordability, trust, a message to Sri Lankan patients coming to India.
As Colonel Saab said, like there should be more information so that they can research and identify which is best for them, which is currently seems to be lacking.
Nobody goes to a hospital for happiness. People go because they need help. Even in India, when someone travels from a small village to a big city for treatment, it can be overwhelming. They struggle to find a place to stay. They find the hospital process is confusing and the treatment protocols hard to understand. If traveling 20 or 30 kilometers for healthcare can be stressful, imagine what it feels like to travel to another country. A country where you don't know anyone, where the language is different, and where everything feels unfamiliar. It is not just a medical journey, it is an emotional one. And it can be very, very hard for the patient and the family. Good morning, good afternoon, and good evening, whichever part of the world you are in. It is my absolute pleasure to welcome you all to this engaging session on the future and opportunities of medical tourism. Medical tourism is no longer just about affordability. It is about quality, trust, and collaboration across borders. Today, we have a distinguished panel bringing perspective from diplomacy, healthcare delivery, and cross-country partnerships. Please join me in welcoming Mr. LG Dissanayake, Minister Counsellor Commerce, Sri Lanka High Commission to India.
Thank you.
Welcome to the show. Colonel Rajeev Mannali, CEO, SUT Pattom Hospital, Thiruvananthapuram. Welcome to the show, Colonel Rajeev Mannali. So let's dive in and explore how we can bridge geographies for better patient care and how medical tourism can become a true engine for regional healthcare cooperation. Minister Counsellor, I will speak to you first. Sri Lanka is a beautiful country, and I have visited myself multiple times. In India, because of our healthcare infrastructure, healthcare quality, healthcare services, we get a lot of patients from neighboring countries, and Sri Lanka is one of them. How do you feel that India and Sri Lanka, how are they placed in terms of medical tourism, especially when it comes to collaboration? So how do you feel that where are we placed and how we can make it better?
Thank you, first of all. And thank you for saying that Sri Lanka is a beautiful country. And it's nice to hear that.
I know a lot of honeymooners, they go to Sri Lanka for honeymoon. And you have some beautiful beaches and some, beautiful cities.
You correctly said, like, there are people who are coming for treatments in India, especially the southern region. And sometimes people come to this part of India as well, Gangaram Hospital. So, I see a lot of areas where we can collaborate, you can have kind of a integrated referral system where sometimes post surgery care could be done in Sri Lanka, kind of a thing. And also maybe there might be scope for mutual recognition on qualifications, which might mobility of these medical
doctors.
professions.
Yeah.
Nurse could go between the two countries. So I see a lot of opportunities. And when it comes to the Sri Lankan healthcare system, we are the best in the region when you look at the numbers, ratios, and even our child mortality rates are comparable with US. But I don't know whether USA is the best country to compare it with. But of course, there are good things happening in Sri Lanka, and we have a free education system and also free health system. But the problem is there are a lot of longer kind of lines for these medical treatments. So some people who can afford choose to come to India for the affordability, not only for the affordability, but also for the quality of treatments they are getting from India.
Understood. So I fully agree with you that you have a beautiful system, healthcare system, but there are some kind of treatments, tertiary care treatment, quaternary care treatments, where you need high-end equipment, skillful doctors. And today we talk about robotics, we talk about AI, and I believe that India is, in terms of quality standard and treatment standard, we are at par with Western world. And Indian doctors, they are not only they are not only skilled doctors for India. I mean, wherever they are working, whether they are working in the US or the Western world, they are doing their best.
Yeah, I can agree with you. I mean, even if you look at the American series, there will be definitely an Indian doctor.
Yeah, absolutely. So, Colonel Mannali, you run a very large facility in Trivandrum, and your hospital is a quaternary care hospital where you are doing transplant, high-end surgeries, robotic surgeries. You must be getting a lot of medical tourism patients from neighboring countries. So how do you address cultural, language, and dietary needs of these foreign patients? How do you manage when they come to your hospital?
I would like to answer this question in different segments. Firstly, when we talk about, for example, Sri Lanka or Maldives, it's so close to Kerala. I'm now talking about the tip of India. We can progressively move upwards. Kerala is so strategically located as far as Sri Lanka and Maldives are concerned. Firstly, the culture is also almost alike. Language, of course, there's a barrier, but it can be overcome. People-to-people friendliness or the connect is very much there. For Sri Lanka and Maldives, I think India and especially Kerala is an automatic choice. It's a natural choice. Everything fits in place. A flight from Sri Lanka, Colombo, Jaffna, wherever, it takes about 40 minutes to Trivandrum or Cochin. Maldives is also almost the same, less than an hour. You can travel both ways. Now, first thing, your proximity.
Yeah.
Second thing is the way of life is not very much different.
Correct.
In fact, Sri Lanka, if not for the Gulf of Mannar, is an extension of Kerala.
Yeah.
Fortunately or unfortunately, there's this natural divide, and therefore there's a difference. I've spent about 2 years in Sri Lanka as part of IPKF. I love that country. Because it's so much like my own state.
Yeah, absolutely.
And people are almost the same. Even the accent is the same, if I may say so. So everything goes for a connect, especially between Sri Lanka and India, Maldives and India. I'm not only talking about the Western systems of medicine or the modern medicine. Look at the other streams of medicine.
Yeah, that is another point I wanted to touch upon. Like, I know Sri Lanka has its own traditional pathies. Like in India, we have Ayurveda. And when we talk about Kerala, Kerala is altogether a different dimension in terms of Ayurveda. So I wanted to touch upon that also, and I will come back to you, Colonel Mannali. Mr. Minister Counsel, if you can shed some light that how traditional pathies are working in Sri Lanka and how they are helping general public in staying healthy.
Yeah, in Sri Lanka, there are two systems like Ayurveda and also the traditional system. So, I'll give you an example. During the tsunami, we got to know a special VIP was airlifted. Then we got to know that none other than it was the Helmut Kohl, the former Chancellor of Germany. So Germany is one of the advanced countries when it comes to allopathic medicine.
Yeah.
But he came to Sri Lanka for alternative treatment.
Wow.
So likewise, a lot of people come to Sri Lanka for this kind of thing. The thing is now, normally our people do not value the traditional system,
Correct.
but the foreigners have learned that, and they are coming to, I think the same is true to Kerala as well when it comes to these traditional methods. And also there are few doctors, like there is a famous traditional doctor in Anuradhapura where, like, when you have a block, people go to him. After few treatments, when they get the scans, no block is found. And also for this women health, also for fibroids and that kind of thing and infertility, there is a famous another doctor where people go to her. And after a few treatments, they can't find the fibroid, and sometimes, and also they get their children without IVF. So there are a lot of these kind of things happening in Sri Lanka, but of course people only know about the allopathic system.
Correct. Actually, I think what we need here is we need to create evidence, we need to make some case studies.
Yeah.
And we need to publish all those, these success stories.
Yes.
In some journals. I'm an allopathic doctor,
Yes.
but I believe in, evidence-based medicine.
Yes.
And when being an allopathic doctor, I also trust Ayurveda, because Ayurveda is I'm an Indian, so Ayurveda is there in my kitchen.
Yeah,
whatever I eat.
Time tested.
Correct. So everywhere Ayurveda is there. So I believe we need to do something like that, where we can create some evidence, we can conduct some studies, we can conduct some trials, and then we can make all these pathies mainstream pathies. So, Colonel Mannali, like Sri Lanka, Kerala is also very popular in terms of traditional pathies, especially Ayurveda. What is your opinion about these traditional pathies, basically Ayurveda, and in Kerala especially?
Before getting into answering this question, I would like to comment on the current state of thought process as to what is good health. We are coming into a thought process where wellness as a whole, it's not just healthcare, it's wellness. So that word wellness has got a very big dimension. What does wellness involve? Wellness involves or includes starting with your lifestyle. So there's a lifestyle correction or lifestyle modification, as the case may be, or even from younger days, you are taught to live in a particular fashion where health is very important, and even your mental and physical health, both. Normally when we talk about healthcare, we only tend to talk about physical health. But we all know mental health is as important as the physical health, maybe even more important. So the lifestyle ensures that your wellness, your well-being, and your attitudinally how well oriented you are towards wellness. So this change will also ensure that there is a preventive element in your thought process as far as healthcare is concerned. Then if someone falls sick, we cannot be absolutely perfect in health all the time. When there is a problem, there must be an ecosystem which caters for early detection and then the cure. So all these three put together in a very balanced manner, that is wellness, and that takes care of the well-being of human beings. Now, coming to these traditional medicines. Traditional medicines, incidentally, every culture, every civilization has had its own medicines. Now, to talk about India, Ayurveda, very famous. It has got its tremendous plus points, but there are some minuses also. Siddha stream of medicine, more popular towards the tip of India and also in Sri Lanka. Sri Lanka also has got Siddha medicine. See, that is again, it has been originated by a Muni or a saint or a sage, Agastya. He had this earlier while we were talking about treatment by way of diagnosis through the pulse. Just the pulse beat tells you how healthy you are. That is very popular in Sri Lanka. It's also popular in Tamil Nadu and a little bit of Kerala too. Unani, it's Arabic medicine. That is another, it has got its pluses and minuses. So is homeopathy, very popular in India, very popular in Sri Lanka too. So we should not be running down any form of medicine. What I think the world today needs is an ideal mix of everything. And I'm not too sure whether we are aware of this particular facility in Bangalore, which treats the body as a whole and the mind also put together. And it has got facilities of all forms of medicine. And the treatment is done by a group of doctors. So that is the sort of thing which actually should come in and occupy, rather than predominance of allopathic medicine or any other form of medicine. It is a combination, and that would work better. That's what I feel. And we should be stepping into that sort of realm of healthcare.
I also of the same opinion that we should create more and more data with the help of AI now, because you pick any industry, whatever you do, you have to do something with AI. I think with the AI, we can put all the data, be it, Ayurveda, Siddha, Unani, homeopathy, and we can come up with a lot of insight. And maybe we can generate confidence in those people, who don't believe all these pathies, but these pathies have been working for years, right? So
there has to be a reason for their existence.
Correct.
If it is only voodoo, then it will not.
Yeah. So, Minister, Counsellor, you are part of Sri Lanka High Commission to India. You must be getting a lot of queries from Sri Lanka, a lot of patients, those who want treatment in India. How do you handle them, and how do you help them in getting best of the treatment in India?
Yeah.
So that's what I want to know.
We actually, to be quite frank, we don't get that kind of request, because there are agents in Sri Lanka where they are the ones who are channeling people to the Indian hospitals. So that network is there. We rarely get that kind of request, to be quite frank, but we get requests from the ones who are doing these medical treatments. So we channel them to the contacts in Sri Lanka. So that's what is happening. We all believe that there should be a combination of all those medical systems. Of course, at the extreme end, if you met with an accident, then of course you have to go through that kind of procedure. But in the long term kind of a thing, it's a mix of those systems. So
Right.
Yeah, so that's obvious. You can't do anything with traditional system. If you have emergency operations had to be done.
Correct.
And also, Colonel Saab mentioned one thing about this allopathic and other medicine. I saw somewhere even the people who actually very prominent people in America, they use homeopathic medicine instead of allopathy. And even in America, the famous person who actually propagated the allopathic system was Rockefeller. So even though they were propagating, because they were trying to make medicine out of their byproduct.
Correct.
So there is always this commercial interest there.
Yeah.
But I heard that these people got homeopathic doctors to treat themselves. So
Wow. Coming back to you, Colonel Mannali, India is currently at very strategic position in terms of medical tourism. In your opinion, what we need to be the best in the world that people look up to India as the best medical value travel destination, or people come to India for treatment. So what do you think, what we can do the best for India?
Okay, I'll answer this taking a cue from Mr. Dissanayake. He mentioned that the flow of patients, the government does not have much say except for providing visa support. That's very true. It's true everywhere. It's not only in Sri Lanka or in India or any other country. Governmental support to leisure travel is there, but governmental support to health-oriented travel is not there across the globe. This is what needs to change, and especially so in India, since we are talking about the Indian context. I think the government has a tourism ministry. They're doing pretty well. Whether it's the central ministry or the state ministries, respective tourisms are being projected. Tourism facilities are being projected and people are flocking in there. Now, is that happening with healthcare tourism? No. Nothing much is being done about it. Nothing much is being, we are talking about it. There's a lip service over it, but nothing more. I would recommend that, like a tourism ministry, let there be a healthcare tourism ministry also, either independent or as part of the tourism ministry. That will give quite a lot of substance to this effort to bring in healthcare and healthcare tourism as a whole.
Correct.
Now, what do we need to do? India is very good, but those are in hubs. In the north, in the south. When you talk about, I heard Mr. Dissanayake talking about Gangaram Hospital. Well, there is one Gangaram. There are so many other Gangarams all over the country.
Correct.
So, why has Mr. Dissanayake talked about Gangaram? Because it has gained fame. But there are so many such facilities all over India in hubs. Now, all these places also have tourist potential. Now, I come back to my own state, Kerala. It's one of the most beautiful places, like Sri Lanka.
Yeah.
It's almost like Sri Lanka. And Kerala probably is the only state where sea, backwaters, hillside, mountains, they all converge.
Correct.
And create ideal and idyllic surroundings for creating wellness.
Yeah, for healing.
For healing.
Best place for the healing.
Best place for healing. So healing, like I was saying earlier, it has got a mental and physical aspect to it.
Correct.
The surroundings will take care of the mental aspect, and the actual procedures will help the physical healing. So both these put together, the government must project these places.
Yeah.
And let the patients, based on their study, the data available, choose those places wherever they wish to go. And now, coming specific to Trivandrum, where I belong to, where my facilities, there are so many good hospitals.
Correct.
But I, as a hospital MD and CEO, would want more foreign patients to come to my hospital. So, let me do my marketing. When I say marketing, it's not purely commercial, but how I project our possibilities and let people decide.
So do you get patients from Sri Lanka as well?
Sri Lanka, we have made efforts, but Sri Lanka, traditionally, the Sri Lankans believe that Chennai is the right place for them to go.
Okay.
We have to break that mental barrier. I had been to Sri Lanka last year, attending a conclave of sorts and medical exhibition and all that. But the flow, I have not been able to break into that mental barrier. So for Sri Lankans, Chennai. Bangalore also comes after that. And Kerala, which is the closest, does not come into the orbit. That is where the governments have to take the role. And I'm sure Mr. Dissanayake, after this interaction, will do something about this.
So, Mr. Dissanayake, I want to, continuing the same question, what do patients, Sri Lankan patients, what do they expect when they come to India in terms of facilities, in terms of speciality? What do you think they want?
Yeah, mostly it's affordability and also Quality,
yeah.
And some institutions, as he Colonel Saab said, like, they have this mental idea that Chennai is the best for some treatments. So that, of course, and I heard like maybe 2.5 years ago, there was a talk about the portal. There was this talk about Heal in India portal. So it seems like it didn't happen.
No, the portal has already come into being, but it's not been projected as such. So people do not access it.
Okay.
So, but more than the portal, it is creating that know-how. Of course, portal is very important, but other than that, what goes by word of mouth is the most important, especially in healthcare and also tourism per se. There is this element of word to mouth, and that word to mouth, and that should be the way of doing things. So there must be road shows, there must be expos, there must be exhibitions, there must be conclaves. So it's people to people exchange. One, it strengthens the diplomatic relationship, the relationship between the nations. Second, it also facilitates creating that accessibility and knowing exactly where to go.
Correct.
And I mean, if I may add, like historically, like Chera people and Sinhalese were aligned against the Cholas. So like we have a
lot of things in common. That's true. And then the food. The food habits are almost the same. It's seafood basically. The Sri Lankans have seafood, the Soda Keralites have, and also Chennai for that matter. So it is, the commonalities are so much.
Correct.
And there is another thought process which I would like to express here. What should the government do in healthcare? I'm a strong advocate of the thought process that government should restrict themselves basically to primary and secondary health, because that is what requires a very wide spread. It should not be very expensive, and everyone should have a reach. Like to talk about the primary and secondary healthcare in Kerala, the same is the case in Chennai and Karnataka also. Every 4 kilometers, you will find a primary health center. That's the way it should be. So everyone should be able to reach there and meet their requirements. So should it be as far as secondary care is concerned. Now when it comes to tertiary and coordinatory care, it's a high-tech world. The potential, the possibilities are immense, and the cost is also immense.
Correct.
So therefore, that's where the private sector should come in. Private sector should be encouraged to spend money, invest in that, and also treat. And it should be so well organized that between the governmental sector and the private sector, there is a choice, there's the best made available, and people should be at liberty to move wherever they wish to, and affordability factors should also be taken care of. Let's say, specific to Sri Lanka, if someone wants to come to India for treatment, the embassy, High Commission in Colombo should be able to give them a very systematic and calibrated thought process, helping them as to giving them the primary data and saying that these are the things that which we have, go wherever you wish to, and we will facilitate it. So that sort of a thing is what I'm talking about or thinking about when I'm talking about a health tourism ministry at the central and the state level.
Basically, we have to bring all the stakeholders to one common platform.
Exactly. And we must change this, mindset. Our problem is the mindset.
Correct.
There's a tourism ministry, so they will take care of everything. No, they're not taking care of everything. Health tourism is taking a background. It's being relegated. Its importance being relegated. Whereas that would bring you the maximum foreign exchange if we are able to put our thoughts together and acts together.
Understood. So my last question to you, Mr. Dissanayake, a message to Sri Lankan patients coming to India.
As Colonel Saab said, like there should be more information so that they can research and identify which is best for them, which is currently seems to be lacking. So that would be one thing, like maybe a portal or somewhere, if they could get this information. And the other thing is, and I think I should add this thing also, nowadays a buzzword is AI, of course, and there is another buzzword which is quantum healing, which we have not mentioned here, that to do with mind. And also there is something called placebo effect.
Correct.
So body has the ability also to heal itself.
So thank you. Colonel Mannali, your message to healthcare providers all those providers who are servicing these foreign patients?
I'll just take a minute to talk about my own hospital. We have got into this act of catering for foreign tourists only very recently. We were quite happy looking after the patients who come to us. We had not made a very deliberate attempt to get people to come into our hospital, especially from abroad. There is so much that we can offer. And SUT Pattom, that's my hospital, it's one of the most affordable hospitals. Because we believe that though we have a corporate setup, we believe that healthcare is something where it is money making is not the only aspect involved in that. There's much more to it. So therefore, I believe that affordability is a factor which hospitals like ours can provide. Accessibility, especially for Sri Lanka and Maldives, we are the most accessible. And Mr. Dissanayake spoke about agents also. In the absence of correct information, when I talked about the people-to-people contact and word-to-mouth spread of information, agents play an important role. We cannot do without them. But how do we train them or create an ecosystem where the agents do not please the patients?
Basically, we have to build an ecosystem of trust.
Exactly.
We need to bring transparency,
affordability,
trust.
Exactly.
Understood. So, like, Indian market of medical tourism is close to 7 billion and it's growing very fast, and it will be maybe 13-14 billion by 2027. In 2 years, it is going to almost double of the current state. And similarly, if I look at global number, so current global numbers in different countries like Turkey, Thailand, UK, US, the global number is close to $150 billion, which is also increasing very fast. But Indian MVT market is growing faster than global number. So I see a huge opportunity. At the same time, we can treat a lot of patients coming to our country, and we can make a difference.
I would like to say something here.
Yeah, please.
In terms of figures, you talked about 7 billion, 13 billion and all that. I believe there's a potential for 70 billion. It's not 13 or 20, 15 or 20 or 23. We have not put our act together. The moment we put our act together and bring in all required aspects together, 70 billion is not a pipe dream. It is easily accessible.
Thank you.
And if I may add one thing,
Yeah.
I forgot to say that Sri Lanka has like top of the line private hospitals also.
I mean, there are a lot of hospitals doing good job in Sri Lanka. So thank you very much, our esteemed panelist, for your insightful perspective. Now it is clear that medical tourism is not just about patients crossing borders. It is about building bridges of trust, infrastructure, and mutual respect. I feel that Sri Lanka and India have unique opportunities to lead in a collaborative healthcare models by combining diplomatic support, private sector excellence, and patient-centric services. We can make this journey seamless for every patient who entrusts us with their health. On that note, let's commit to making medical tourism not just a transaction, but a relationship. Thank you very much. Thanks a lot.